Ian Trottier here from San Marcos at Reawaken Tour. This is like stop number 10 at least now, right? 10 or 11. It's growing and it's continuing, and more sites. And I think South Carolina, Myrtle Beach was just recently added. I have the wonderful and very elegant Dr. Shanon Kroner with me. Did I pronounce your name right?
Yes.
Good. Okay, that's a good smile. Shanon, we haven't seen each other since Dallas.
San Antonio.
Oh, San Antonio.
Right.
And that was with Bianca. We were with Bianca Garza.
Okay.
Was that who we were with? I don't remember. Latinos for Trump.
She was there.
She was there?
Yes.
Okay. Shanon, you're a California-based doctor, and you have roots historically with your family in California. Bring listeners. Is this the first time you've joined the show?
On your show?
I think it's the first time.
Yes, I've known you for a while, many years.
Many years?
Yeah, we met at AmpFest in
No, we did
2020.
not. We did?
Yes.
No kidding.
But I've never been on your show before, so this is a first.
We met at AmpFest?
Yes.
I did not know that. So that actually paved the way for me to meet the woman that I mentioned to.
Bianca.
No.
Okay.
I'm not going to mention her name on the recording, but anyway, so at that AmpFest
Yes.
is where Zach Voorhees and I connected.
Yeah, I remember him.
And I didn't realize we go
I
back.
met him there as well.
You met him there as well?
Yes.
Okay, so but this is the first time you've joined Discussion of Truth, and tell listeners a little bit about yourself.
Okay. So my name is Dr. Shanon Kroner. I'm the Executive Director of Freedom of Religion United Solutions, also known as For Us. And
Have you worked with Jexit at all?
I mean, I know them.
You haven't worked with them yet? Or
We haven't worked together, but I know Michelle.
you do know Michelle, okay.
Yeah.
She just joined my show last week.
Oh,
For
really?
the second time, yeah.
Okay. Yeah, so Michelle's actually good friends with one of my cousins.
Okay.
So that's how I got to meet Michelle.
In Florida.
Yes. But yeah, they're doing great work. But so my organization, I started in 2019, so pre-COVID, because in California we have the strictest vaccine mandate laws in the nation. In 2015, we lost our personal belief and religious exemption for children to opt out of vaccinations in order to go to school. And then in 2019, we lost our medical exemptions for children to opt out to go to school. And so when that happened in 2019, I started my organization For Us, and I started to build a faith coalition. So I work with, back then it was, a handful. I was making like cold calling pastors and stuff and seeing what their opinion is on vaccine mandates. And so I started off with, one pastor here and another pastor there. And today
In California?
Throughout the country.
Okay.
Yeah. And then now we have 57 faith leaders. And I work with people of all faiths. And, over the last year, because of COVID, we've been able to help thousands of people keep their job with our religious exemption. We have a really great religious exemption that was written by our legal team. And it's on our website and it's free. And we are a nonprofit, so I just say that if someone wants to download our religious exemption, they can donate if they can. And that's what I've been doing.
Thank you for your service. The religious exemption, does it stand legally in the state of California?
So not for children, but for people to keep their jobs and for college students. Our religious exemption is a little bit different. Like I said, it was written by our legal team, and we've also added a section to our religious exemption that has an area for a notary. So we ask that people, download the exemption, fill it out, and then go and get it notarized. And once they get it notarized, a notary is someone who is a signature of the state. They represent the state, and
the judicial system, right?
They give it a stamp of approval. So it's really hard for an employer to, deny that exemption if it's been notarized. So that's why our exemption works, and it's for we have exemptions for first responders, school teachers, healthcare workers, college students, and pretty much anybody. And they're really easy to get on our website, which is forunitedsolutions.org, FOR unitedsolutions.org.
Okay. Talk about some of the successes that you've had with people that have gone to your site, downloaded, and applied them.
Oh my God. Well, we've had lots of successes. We really have helped actually like thousands of people keep their job, especially in the last year. So many college students be able to stay in college without having to get the COVID vaccine. And then we also have, a vaccine exemption for little kids that don't want to get any childhood vaccine in the states that still allow religious exemptions. California is not one of those, and there's California, New York, Connecticut, Mississippi, West Virginia, and Maine that do not allow religious exemptions for children. But all the rest of the states, you can still use one of our exemptions for children, and not just for COVID, but for like whatever, if they want to get out of getting the MMR vaccine. So that's, really, we've had so much success. And then actually I started working with the military recently. And our organization put together a letter and launched it in October 2021 because I knew that our military was at risk for being kicked out if they had not gotten our service members were being kicked out if they were not getting the COVID vaccine. And so we put together a letter and ended up getting close to 12,000 people to sign it. And in December, I went to D.C. I met with 17 members of Congress. I brought with me a Navy commander and a gunnery sergeant. And we were able to sit down with people like Rand Paul and Jim Jordan and Marjorie Taylor Greene and Ronnie Jackson, and sit down and really kind of have this like heart-to-heart about like, look, this is what's happening. We're decimating our military right now because of all these really great, healthy men and women who are going to be kicked out. And
briefly, just
when we met with Congressman Darrell Issa in D.C., he was really a champion for what we were doing and protecting the religious rights of our military. And so ever since we met with him, he's been, really outspoken in protecting our service members and trying to find ways to help keep them employed with our military if they're not vaccinated. And one of the things that my organization's working on now is there's several bills in California that are all COVID related, but two of them specifically that I'm really concerned about. One of them is SB 866, and that actually lowers the age of consent to 12 for children who can go and get vaccinated for any vaccine without a parent's permission, without a parent's consent. So children are going to be 12 years old and up. If that bill were to pass, any child that's 12 and older can go into a CVS pharmacy or Rite Aid or go into their doctor and get vaccinated for whatever vaccine they wanted, whether it's COVID or HPV or hepatitis B or anything, without a parent's knowledge. And then there's another bill, SB 871, which actually mandates the COVID-19 vaccine for all children in California, grades preschool through 12, in order for them to go to school. If a child, and without the option of a religious exemption or a personal belief exemption. So if that bill were to pass, then any child who doesn't get the vaccine for COVID would not be allowed to attend public or private school.
Insanity.
Yeah, so right now, actually, our website, forunitedsolutions.org, there is a pop-up right when you go to the website, so that if you are a faith leader, if you are a religious leader, such as a pastor or priest or rabbi or chaplain, we're trying to gain support from the religious angle to stop this bill. So we're asking any faith leaders to sign this letter that we have. It's addressed to the California legislature.
Who's behind this bill? That's
Senator Pan. It's always Senator Pan. It's Senator Pan.
PAN.
PAN. Senator Richard Pan. He was the one behind SB 277 in 2015, which took away our personal belief and religious exemptions. He was behind SB 276 in 2009, which took away our 2019, which took away our medical exemptions. and now he's behind this new bill, SB 871, to mandate the COVID-19 vaccine.
And where does he live?
He's up in the Sacramento area.
Interesting. And is there anyone behind him that supports him? Who do you think is
I think that he has ties to the CCP. But
Okay. Well, why are you laughing?
I mean, that's what I can't prove that.
Your intuition?
It's just based on.
Is he Asian?
He is.
Is Chinese?
Yeah.
Was he born in China or the U.S.? You don't know that?
No, but I mean, I hear that. That's what I hear from people.
You don't think it matters?
Of course it matters. Everything matters.
Yeah.
Everything matters in this whole thing. But,
Was he born in China?
I believe so. Maybe. I think so.
So he's a political plant, possibly.
I believe so. Because all of his bills are always like super overreaching, and they're just tyrannical bills. I mean, he's involved in he wants to get every single person, kid and adult, every person in California vaccinated for everything.
He wants everybody in California to be vaccinated.
Yeah, not just COVID vaccine, but like
susceptible to
every single vaccine.
Mandates on vaccines.
He's like the most pro-mandate person that exists. Like, more so than Bill Gates. I mean, everything. He wants every vaccine mandated. It's scary. I'm glad this is his last term. So.
Where did he go to college? Do you know?
I don't know. I don't really know.
You don't know a lot of history about him?
No. But I just know he's a bad guy. He's not nice. He's like bad intentions. So,
does he know about you?
Yes, I've met him before.
Okay. You told him how you feel?
Yes, and he hates me.
Good.
So, yeah, I called him out once. He was doing a press conference at UCLA, and I was there, and I, started asking him some questions. First, I was really polite, asking him questions, and he turned his back and walked away, wouldn't answer a single question. And so I, kind of walked behind him, asking him more questions, and he wouldn't respond. And my questions were not crazy questions.
What were they?
Like, well, this was back in 2019 when he he got rid of our medical exemptions, okay? So we need to think about what that means. So if a child has a medical issue, such as, let's say they have a seizure disorder, right? Or let's say a child has autism, or some kind of neurological disorder, or Tourette's syndrome, which many children do, they would still be mandated to get all the childhood vaccines that he was mandating, without the option of a medical exemption. Or
religious exemption.
But SB 276 was specifically getting rid of the medical exemption. So, some of my questions were, why is it that a child or teenager could actually have hepatitis B and go to school, but a child who doesn't get the hepatitis B vaccine would not be allowed to go to school? I think that's a very reasonable question. He wouldn't answer that. Then I said, this bill causes...
He wouldn't answer that.
He would not answer that. And then I said, this bill causes segregation of children, those, being kicked out of school. And I said, what's your opinion about segregation? Because clearly you think it's okay for children who are not vaccinated, even if it's for one vaccine, to be put into school with other kids, and then I mentioned also, like, how does he plan to prevent whether a child is vaccinated or not vaccinated, they're going to still be playing on the same play yard. They're going to be still playing in the same baseball teams. Why is that okay? That's okay, but then in school, in classrooms, that's not okay. So these are all very reasonable, not crazy conspiracy questions, which he would not answer. So it is what it is.
He doesn't like you for that because you were persistent and
I'm very persistent, and I've helped a lot of people. There's another bill that's right now in California that he also has his name on, that's mandating all employers make sure that all employees show proof of COVID vaccination. So that's a bill in California where every single person who's employed is going to be expected to show proof of COVID vaccination. So
for any job.
For any job. It doesn't matter if you work at a bakery or you're a fireman or you're the trash guy. It doesn't matter. You're going to have to show proof of vaccination if you're employed. I mean, it's tyrannical. It's crazy, actually. So.
Did you ever see yourself doing the things that you're doing right now, Shanon? If we go back 10 years?
Well, I mean, that's a great question. We can go back 20 years, actually. So my doctorate my master's degree is in special education. My doctorate's in psychology. I've been working with kids with special needs since the early 2000s. And I've met more children that are vaccine injured than anybody should have ever met or known. I have been around hundreds, if not thousands, of kids who have been vaccine injured. And so, I started learning about vaccine injury in my early 20s. I wrote my doctoral dissertation. I wrote that in 2013. It's all about vaccine choice. And, in 2015, we lost the religious choice to opt out of vaccine. So I've really been doing this my entire adult life. So, I mean...
Were you working with Del Bigtree back then?
He and I have never actually, we don't work together, but we know each other. We're friendly, so we're friends. He's been on different panels that I've hosted. When we first met at CPAC in 2020, Del was on my panel there.
AmFest.
Oh, AmFest, not CPAC. AmFest.
It's okay, catch it. It's okay. It's good. That's why I'm doing it. That's why I do what I do, because I'm sharp.
That's what you do. Thank you. Thank you. I've never spoken at CPAC. That'd be pretty cool, but I haven't.
Maybe we can make that happen.
Let's do it.
So you and Del, anyway, who are some of what I'm getting at is this. Now, from my angle, I was looking at the Zika virus in 2016 in Miami.
Yeah.
And from there, I'm starting to look at some of these other people like Tenpenny.
Yes. So she's a friend of mine. All these people are friends of mine. I've been in this fight since the beginning.
Yeah.
So I know Sherry Tenpenny, I know Dr. Judy Mikovits, and Del Bigtree, and Andy Wakefield, and Bobby Kennedy.
Yeah.
That's my crew.
Those are your people. Those are your people, Shanon.
Yes.
What, for listeners, in your view?
Yeah.
What is really happening here? Why and how, Shanon? Why and how are we seeing a basic meshing and a attempted control of the political arena through the medical field? Why is that happening?
It's all money. It's all based on money. It's all funding and money, big pharma, and who gets the most money and sell our product. Think about it, right? If you vaccinate everyone and they have some kind of an injury, or it could be even a cancer. So many of the ingredients in the vaccines are carcinogenic, neurotoxic. So even if you don't see a reaction right away, look, America right now, we're super unhealthy. So many people who have tics, seizure disorders, ADHD. I don't know where I left off at.
You're saying anyone who doesn't have an injection. You were talking
so I was
about
just saying that, we start off on day one of life being injected.
The country's sick.
The CDC recommends the hepatitis B vaccine for babies on day one, right? Hepatitis B is a sexually transmitted disease, or you can get it from sharing needles with drugs. I don't know a single 1-day-old baby that's
doing either of those.
That's doing, yeah, exactly. But the CDC requires and recommends that children on day one get hepatitis B vaccine. Then, at their the next visit, they get a series of they get the DTaP vaccine and a couple others, the Hib vaccine. Then a couple months later, they get another round of injections. A couple months later, they get another round of injections. By 1 year old, then they need to get like the MMR shot and the chickenpox shot. So we're constantly injecting toxins into a baby that hasn't even built their immune system.
Yeah, sure.
So what we're doing is we are creating people who will ultimately then need medications. So it's this vicious cycle of dependency of medicines and doctors and the need for pharma, the need for pharmaceuticals. It's it's the perfect money-making scam.
So Shanon, let's insert this. Let me ask the question. How does this? You mentioned Bill Gates, right? So you're saying this, the Senator Pan is even more adamant about everybody being injected. Even Bill Gates, hasn't he said that everybody on the planet needs to be injected with this, right? So how, in your view, does technology as we know it today, how does that? And I'm not talking about the pharmaceutical health. You receive this injection and it's going to help you because it's technically a vaccine. But we know that this COVID-19 it's not even a vaccine. It's an inoculation. But
yes.
if we take people like Bill Gates, right, that is such a superhero to humanity, and he's donated all of his money to healthcare because he cares about all of us, Shanon. He cares about our health, which is total BS, right? But he cares about is his money,
right?
He cares about his bank account and he cares about his control.
Cares about depopulation.
What Shanon, what do you mean by that? What are you talking about?
Well, isn't that the ultimate goal of all these evildoers?
My goodness. Okay.
Depopulating.
You went there. You better run with that.
Well, it makes the most sense. There's actually clips of
useless
these people.
feeders.
Right. There's
consumers.
Actually, clips. Look at the Gates Foundation. There's a video I've watched of Melinda Gates going into they're always doing humanitarian work in Africa, right?
Sure, supposedly, yeah. Right.
Air quotes. Humanitarian work, air quotes. So they're going into Africa and they...
Microsoft cryptocurrency patent. Are you going with that? No.
No,
oh, okay.
They have found, they've injected their vaccines into the population.
To these innocent African...
To women, to children, but, to women where... They have found that, scientists, doctors have found that there is, an ingredient in some of the polio vaccines and stuff that are given to these women to cause them to not be fertile anymore. So it's obvious that one of the goals is depopulation. The planet is, according to them, the planet is too crowded. And we're losing, there's not enough food to feed the planet. I don't know. I don't know. I just know that it's whatever it is that they're doing is.
But there is a depopulation agenda.
I believe so. Look at what we did with COVID, right? How many people were put into a hospital and then so mistreated and then died? Unnecessarily. There's so many people who unnecessarily died. Look, I'm not one of those people that doesn't believe COVID exists. I think COVID does exist. I think it's a bioweapon. I myself had COVID in October and it was terrible. Very different from a cold, very different from a flu. And, so I know that it exists, but there are treatment protocols that work and are healthier than sticking someone in a hospital and killing them. So I don't know what else to say about
intubating
that.
them.
Yeah. I think that most of the people who died from COVID, it's more because of medical error than actually COVID.
So, where do we go from here, Shannon? You've been working hard now. Well, I mean, before your dissertation, and right. So you've been at this.
I've been at this for a long time, like over 20 years. So.
And you obviously have a heart for the children.
Yes.
And certainly those with special needs.
Definitely.
Where do you go from here? Because California is a trend-setting state, right? So because of the power that the state has economically and through agriculture, through science, through whatever it is, the media, everything, the state, that sets a trend for the rest of the country. People like yourself are incredibly important to the survival of freedoms and liberties that the founders of the country developed.
Right.
Where does your work take you here? Where do you go from here?
What I'm trying to do is build a faith army, so to speak. We have, like I said, we have like 57 faith leaders now. I would love that to be, 100 faith leaders or 500 faith leaders. I think the only way that we're going to win this war on, what's happening, this erosion, the eroding of our constitutional rights. I mean, there's a war upon us. There's a war to take God out of everything. There's a war to take our constitutional First Amendment rights away and a bunch of other amendments as well. But I think that, like what I'm doing is I really need more faith leaders to unite and understand what's happening and be a part of our coalition. And
is there a certain faith that seems to gravitate to the work that you're doing?
Yeah, definitely. I would say that, of our faith coalition, I definitely have a lot more Christian pastors than any of the other faiths. We have several rabbis, like a handful of rabbis. I think that one of the things is that I think the aborted fetal DNA in vaccines is a really big issue for a lot of Christians. And those who really know the truth about that, it's not just in, the Johnson & Johnson COVID vaccine. It's not just in the live virus vaccines, but, human aborted fetuses are used to test all vaccines. And so I think that's a big deal for a lot of people. There are different faiths that choose not to vaccinate for different reasons. The ingredients that are in vaccines are disgusting. There's bovine cow serum, there's pig parts, monkey kidney cells, chicken embryo.
What type of vaccines are these?
These are all the childhood vaccines.
Wow.
People don't know. People don't do the research. People need to do the research. That's my biggest. If there's one thing I can say that people can take away from this is that do the research. Like, people have to do their own research before they just listen to a doctor or listen to the media before they inject themselves with something and think it's nothing. It's not just water that's going into them. So there's preservatives, there's aluminum, there's formaldehyde. Aluminum is a neurotoxin. Formaldehyde is a carcinogen.
So you'll continue forth with the vaccine rights.
My goal is to protect the religious freedom of vaccine choice. So to protect the religious exemption so that people have a choice.
Yeah.
Because a lot of these mandates are coming. They still will continue. Whatever the next pandemic that sweeps our world, there'll be more vaccines. There's so many vaccines in the pipeline right now. They're talking about an AIDS vaccine, Everybody needs to be aware of what's going on.
Again, ladies and gentlemen, Dr. Shanon Kroner. And Shannon, how can listeners get in touch with you, follow your work?
So they can go to forunitedsolutions.org. That's FORUnitedSolutions.org. Right when you go on there, there's a pop-up there for our letter that opposes SB 871. And then I have a link on there where you can sign up for our newsletter. I send out a newsletter every, once a week or once every couple weeks, and just keep people up to date on what's going on, new legislation, new whatever it is, if there's places I'm going to be speaking, things like that. So
awesome. Thank you for joining the program. Yeah, every time I ask you to join the program, you always say you don't have time.
That's not true.
No, it's not true. It's not true.
But I'm glad I finally did. So, thank you.